Good evening, everyone. First of all, thank you everyone to join, especially at this time. We all going through with difficult times, and that we know how much our community care about each other. That's your presence says itself. Again, will big thank you of Suman Sahaji organizing this information session. Due to some reason, there are a lot of people couldn't join. They are essential workers. They are at work. So for that reason, we letting everybody know we are recording this session and we will be broadcasting later on for them and for the other people as well, so they can have the information.
Before we begin our meeting, I'd like to acknowledge the traditional owner of the land where I am at today. That's the Daruk people, and recognize their contribution to their continuing connection to our land, water, and culture. I also like to acknowledge and pay my respect to their elders, past, present, and emerging. We have tonight with us our guest who will be answering to all your question. Is not me. I thank the community for registering and joining us and raising your concern about the current health restrictions and other restrictions that actually health order and the other restrictions that are in place, and it's not very clear. So you reach out to me and you wanted me to organize a session, and I have organized it, but it's not me who will be answering you all these questions. Is our expert who will be answering all your questions. We have with us Dr. Deepak Rai. He's a medical advisor with Department of Health, and he will be answering your question.
I've just quickly skimmed through the questions, and I can see there's a common theme around the vaccines. A lot of questions around the vaccines, and a lot of queries, as we all have, because of so much information in such a short period of time. It creates a lot of confusion. So I thought maybe just give a brief of vaccines, what's the immunity and how vaccines work and how they're manufactured and all that before I start the questions, so that to be a bit clear. Otherwise, there may be a few technical things which won't be very clear. And this is not meant for the doctors like Dr. Yadav Singh we have got here. This is just for people who don't have medical background. So basically, the immunity is mainly of two types. So we have innate immunity we are born with, and acquired immunity. So acquired immunity, again, there are two types. One is T cell and one is humoral or antibodies. So there's cells that fight with the infection, and then the antibodies that fight with the infection. So vaccine not just create antibodies, they stimulate cell-mediated reactions as well. So just to highlight that antibodies are not the only thing which helps you fight with the infection. The cell-mediated, the cells there in the body, they fight with the virus or they kill the virus with different type of reactions or chemicals they release. And so basically there are two mechanisms. So when people say antibodies, they think, oh, this person didn't produce any antibody. That doesn't mean the vaccine hasn't given any resistance to that particular person. So, I mean, again, there will be few clarification. I can do that later. And especially with COVID vaccine, normal vaccine research, it takes around like minimum, the fastest so far was around 5-6 years. And this all, I mean, even I'm surprised that we managed to get an effective vaccine within a year. So there are a lot of still data that we need. So obviously there are quite a few things that we still can't give you information without waiting or without having that time. So there's a lot of limitations. And with all that limitations, what we have got, I think is still is a very kind of good result. And yeah, I think I'll just start taking questions. Or
I request Senior Constable Mani Vagela, Constable Karan Chauhan, and Rashna Soni, if you just very briefly address all the audience.
As I earlier said, we're very pleased to have you all guys on board. I'm sure there are a lot of questions and confusion around what's permissible and what's not. It will more than happy be able to clarify whatever questions you guys have. I do like to bring this to everyone's attention is the restrictions that are in place and which is causing a lot of confusion. The idea behind that is to beat the virus as opposed to beating a police fine. Yeah.
It's not a jail term, or it's nothing to stop the community. The restrictions are for people's safety and to reduce the spread of virus. Thank you, Sumanji. Karan, do you want to add something to it?
Just the one thing that I'll add, because I've seen this happening in my house. I know how much we all love our family WhatsApp groups and stuff like that. Just one thing, just be very cautious about the things we forward to other groups that we might be involved in. If information that you're receiving is not verified and it doesn't have a verified person that's actually making the information, then don't forward it. The misinformation is what creates a lot of confusion.
My question is basically related to the mental health, that there are a lot of people coming nowadays with a lot of fear and insecurity of regarding their jobs, regarding their well-being. Even some Facebook groups I'm seeing posting that a lot of shoplifting is happening in Schofield because people are having hardship. So there is kind of a fear and in the society. I just wanted to ask, as a council, as a government, what are the things is being done to address this?
I'm assuming, what I understood from that question was what extra measures are being taken place to make businesses a bit comfortable in operating in this circumstance. The New South Wales Police have deployed, as you've probably seen, a lot of staff, over 100 in some cases, throughout the Southwest Metropolitan region. And there's always extra staff on here at Parramatta Police Area Command to solely focus on the jobs that we get that are pandemic related. So there's always extra staff available. It's essential, obviously, for you guys to give us a call or call the police assistance line if there are any issues. And you can always call the station if there are any other questions. But there has been a large amount of extra staff that's specifically rostered on to address any pandemic related jobs that come through.
Is to you, Dr. Deepakji. Why are Australians cancelling AstraZeneca jabs? But some other countries have no problem with it.
Oh, well, I can't answer for others, but definitely AstraZeneca vaccine along with Pfizer vaccine, they both are approved for adults. So Pfizer vaccine for 16 years onwards and AstraZeneca 18 years onwards. For any vaccine before we approve, there is no medicine which doesn't have side effects. So what we kind of assess is we call benefit risk assessment. So before approval of any vaccine, we do benefit risk. So obviously there has to be some benefit and there has to be some risk. And based on that, we approve any vaccine. And usually we have like very long data. So say, for example, safety data for 1 year or 5 years or something like that. With this vaccine, everything has been done in a very short time. So obviously we didn't have luxury of having a safety data for 1 year or efficacy data for 5 years and all these like how long the immunity is going to last and all that. So basically we made a decision based on 2-month safety data, and then we wanted to have monthly safety reports. So what happened with AstraZeneca is like, once it was approved, it's being used worldwide, and everywhere the reactions are coming. But in Australia, I think even 1 or 2, I think, serious cases with thrombosis happened, and that was reported in the media, and that created significant what we call vaccine hesitancy. That probably is the most common cause behind all this, like people don't want AstraZeneca, but from government side, there's nothing like you can't have AstraZeneca. The recommendation is from ATAGI, which is the Technical Advisory Committee for Vaccination. And that again is a recommendation, it's not ruling. So they recommend that 60 years plus, they should have AstraZeneca, and under 16 years, they can have Pfizer. But it's not like you can't have any vaccine. And why people are not taking, I think that is probably related to vaccine hesitancy caused by this news in the media. Like I think there were a few casualties associated with what we call TTS. So basically it causes clot in the brain and can cause even death. It has happened in every other country, but probably it wasn't highlighted as much as it was done here. And again, I'll come back to risk benefit. So probably in Australia, we were in a much better situation. So balancing that risk was probably the main thing. So if there's a country where we have got 100,000 cases happening every day, one death probably no one will even notice, where hundreds of thousands of people dying every day because of COVID. But here, since we were in a very good situation where there was hardly any COVID, and one death caused by a vaccine created a lot of kind of vaccine hesitancy. So I think that's the reason why people are kind of rejecting AstraZeneca, but I don't think there is any other reason why, people should be rejecting.
Thank you. The next question from him is another good one. Are we going to use COVID injection, same as a flu vaccine in future? Like every year, we all have to go for 2 doses.
Well, I wish I had a crystal ball, but we have some data, because as I said, the vaccine development takes years and years of work, like 5 year, 10 year, even 15 year. Even after 30 years, we don't have a vaccine for HIV. So before we keep that much time, there's no way we can judge how long immunity is going to last. But we have some data from 6-month study. So initially we had only 2-month data for the vaccines. Now we have got 6-month study. And again, I'll just highlight 2 things. There is one thing called efficacy of vaccine. There is one thing called immunogenicity of vaccine. So immunogenicity is the amount of antibodies that the vaccine is creating. Efficacy is how much that vaccine is preventing the disease. So efficacy is not happening that quickly. So what they have done is the immunogenicity. So they check the titer, so the amount of antibody, and they found that after 6 months, the antibody level has gone down. So currently there is a study going on for the booster dose. I'm talking about the Pfizer vaccine, and then at 6 months or 12 months. So based on that study, we'll recommend whether there'll be need for booster at 6 months or 12 months. That's one reason for booster. Another reason is to cover for the COVID variants. So there's another discussion going on whether we need a booster to cover for the variant, because whatever vaccine we have got was based on prototype, that's the Wuhan strain. So basically all the studies, everything were done for that. So now the vaccine efficacy against the new strain, which is predominant now, the Delta strain, whether vaccine will work or not, you have to do an efficacy study where you take a group of unvaccinated and vaccinated and compare. But it's very hard because majority of countries, they have done significant number of vaccinations. So it's hard to get that amount, like 50, 60,000 people who are not vaccinated and vaccinated. So what we are relying is on the antibody titers. So they have done, again, these antibody assays for Delta strain, and they found it does work. Whether that translates into efficacy or prevention of the disease, that again is kind of questionable, but it doesn't mean that it doesn't work. It still works for against the new strains as well. But whether it will be annual or whether it will be just one-off, it's hard to say. But given that what we have got at this stage, I definitely feel we'll need a booster, whether it will be annual. Unlikely it will be 6-monthly booster, but maybe we'll need the annual booster, just like flu vaccine. But again, we don't know till we see how things go with the virus, because we have seen how much it has changed in the last 1.5 years. We started with something and now we have got something completely different. And we can't predict that how virus is going to behave. But whatever we have got, it looks like we'll definitely need a booster, but how frequently? Again, it depends what the study outcome is. If they suggest like 6-monthly, then we'll have to do 6-monthly. But likelihood is that 12-monthly should be all right, because we'll have a significant amount of population who will be vaccinated. So there won't be this big spreads like it's happening now. So hopefully you can manage with a annual booster.
The first question, and again, this one is for you, Dr. Deepakji. Why don't we increase quarantine time more than 14 days? A lot of people get symptoms after 2 weeks. It might work and help from spreading the virus.
I think half of question I don't agree. It's not like a lot of people are getting after 14 days. So if you look at the data, it's hardly around 1% people or even less who report symptoms after 14 days. So it's a logistical reason. It's not from health, I can tell the government, okay, 0.5% have symptoms after 14 days or 18 days or 21 days. But imagine organizing all that quarantine facilities and spending all that money, millions of taxpayer dollars, whether it's worth or not. And again, going back to the incubation period. So a normal incubation period maximum is up to 14 days, and it on an average is 4 to 6 days. So it's very, very unlikely that it will be beyond 14 days. So it's not a lot of, it's very small percentage. And with the Delta variant, this is much more infectious, and the incubation period is even much shorter. People get symptoms even after 24 to 48 hours. So even that reports, which says like after 14 days, you can have in less than 1%, that also is probably not applicable for Delta, which is much quicker and symptoms happen much earlier. So again, it's the government's decision. If they have resources, they can make it 3 week or 4 week, but I don't think that's a kind of logical step the government will take just to say one or two or few people who might present. It's all theoretical again. There is no proof. If you read the literature, there have been few reports, but that's based on a very small cohort. So very unlikely that will happen. And majority of them will happen before 14 days. So I don't think there is any need for extending the quarantine, and it's accepted worldwide. So it's not just Australia. And when I'm saying worldwide, it's based on the millions and millions of people's data.
Yes, thank you. Next question are for our Parramatta Police Area Command. And the question is, are partners allowed to visit at home if they live few kilometers away on a special occasions, as a lot of people live alone here?
I would just like to let you know, Constable Karan Chauhan had to leave to attend one of her emergency jobs. So from here onwards, it will be me and Rachna who will be answering any questions on behalf of Parramatta Police. To answer questions about partner visiting other partners, yes, it is allowed, regardless of the occasion. Partners are allowed to visit each other. However, still due care needs to be taken. You need to consider where the partner that you're visiting lives. Your partner lives by yourself or lives with his or her family. That's not an issue. But if partner happens to live in one of those shared accommodation with unrelated people, is that the risk that you want to take, and in doing so, prepare to put the community at risk as well? But to answer, can partners visit each other? Yes.
There's a lot of myth between people that AstraZeneca is not safe and Pfizer is better. If we will give more clarification, and it will be better for the people, this clarification really people need.
Naminji, there are two things. One is efficacy, one is safety. So I think efficacy-wise also there is a bit of difference, and safety-wise also there is a bit of difference between two vaccines. In fact, every other vaccine is different. So efficacy-wise, Pfizer vaccine had efficacy of around 95% or 94.5%. AstraZeneca had around 70%. So that's where a bit of difference there. But again, these are based on the clinical trial. Real world may be different. For Pfizer, efficacy was more. Safety-wise, initially they both were considered safe vaccine, and they are still a safe vaccine. I'm not saying that AstraZeneca is not safe. It is still safe, but as I explained before, because of a few adverse events which happened, unfortunately, the AstraZeneca vaccine got really bad publicity, and there was a lot of vaccine hesitancy against AstraZeneca. But I still think it's a very good vaccine, and it has got its role in our community. And there's nothing which has changed, because all these clotting and all that happened and highlighted in the media. This has happened all over the world, even in India. Yeah. But it's still they're going ahead with that. So again, it's balancing the benefit risk. So you put COVID at one side and you put the vaccine on one side, on those side effects on one side. The balance is completely in favor of vaccine. So someone said, I can't remember who said that, but they said that dying from a lightning is probably more likely than dying from vaccine side effect. That's what I will say. Chances of dying in a car accident is much, much more than getting the side effect from the vaccine. So out of millions and millions of doses given, the few hundreds of total worldwide, I'm talking about reports of deaths from the vaccine, which is unfortunate, but that has happened. Same with Pfizer. So Pfizer is not like it doesn't have any side effects. It does. And those side effects, fortunately, at this stage are minor. And they're happening in young adults who have got better kind of physical conditions and they cope well. And again, I don't want to create any panic, but there have been reports, which probably is in the media as well, like recent cases of myocarditis, which is inflammation of heart muscles in the younger adults, mainly males after second dose of Pfizer vaccine. But luckily, no deaths have happened. So that's why it obviously didn't kind of get much of media attention. But imagine one death, hope nothing happens, then see how media would have reacted. So no vaccine or no medicine for that matter is free of side effects. That's why we do risk and benefit balance. So I think both vaccines are pretty good. They both have their place for our vaccine coverage. And obviously for a few things, Pfizer is better. And for a few things, AstraZeneca may be better. But again, all this is theoretical thing. We have to go for logistics. What we have, there is no point telling people like, if you go to India, that Pfizer is the best. But what's the point? We don't have it. So same thing, I think it probably comes back to the supply. This government ordered a lot of AstraZeneca vaccine, and Pfizer obviously was limited because everyone is after that. So it's again kind of balancing of everything, risk benefit, what situation we are in, and what we can procure, what we can get. There's no point saying, oh, this is the best vaccine if you can't get it. I mean, take example of America. They could afford having all this only mRNA vaccine like Moderna and Pfizer. So they're just giving Moderna and Pfizer because they can do that. They have got manufacturing capability. So they're not using AstraZeneca or any other vaccine. So it all depends on what we can get and what is our benefit risk situation. So, but otherwise, I mean, we're talking about AstraZeneca, 70% of people say, oh, it's very low. But the flu vaccine, which we take every year, has got efficacy of the best case scenario is around 50, 55%. So 70% is not less. And that again is in a small clinical trial. So if say you have given 100 people and 70 or 75 people are protected, so it doesn't stay there because of those 75% people, rest 25% people will also have some protection. Because if they're not getting infection, the chances of getting other people from those people, that's basically the concept of herd immunity. So it still is a good vaccine. I'm not saying it's a bad vaccine. So I don't know why this argument going on. And it has created a lot of vaccine hesitancy, but they both are good vaccine. Maybe one has got more role, one has less, one has got more efficacy, one has got less, but these are all theoretical questions. We have to see what we have got and what situation we are in. So yeah, I mean, that's my kind of opinion. Anything else?
So conclusion is that one should recommend that we should have as soon as possible whichever is available instead of waiting for Pfizer is a foolish idea. Whichever is available, one should have it as soon as possible.
Again, that's what I'm saying. So recommendation is like 60 is plus you should take AstraZeneca, less than 60 you should take Pfizer. But I would say if you are getting anything, just take it. I mean, the GPs are giving AstraZeneca and Pfizer. But again, it's a personal decision. People take their own informed decision. They search all these informations and they take decision. So, but overall, I think it's still whatever you get. If you get Pfizer, obviously people are preferring that. That's okay. But if you can't get, it's better to have one vaccine rather than being unvaccinated.
My question is to Dr. Rai. The lot of people who don't have a Medicare, they are having problems in booking this. There are a large number of students or large number of people on the working visas. So I've been approached in Harris Park from our Little India for so many people. Can we organize a camp or an information thing in what you call Harris Park, a Pfizer clinic? Is it possible, Dr. Rai, to request for one?
Basically, my area is the vaccine evaluation and approvals and all that. This is a different department, the vaccine rolling out. So that's completely different department, but definitely there is nothing like that cannot be done. So, but the department which needs to be contacted will be NSW Health rather than the federal, because I work for federal department of health. So this is a state department. So unfortunately, I won't be of much help.
That's
But
all right.
definitely, if you contact the NSW Health, they will definitely figure it out. So you're saying that the people who don't have Medicare, they are not getting vaccine, or?
They are having issues like, for example, people on student visas or people who are on working visas.
Yeah.
They have to, while booking, they get problems because, how some medical centers have started giving Pfizer and AstraZeneca vaccines.
Yeah.
They always ask that whether you have Medicare or not.
Yeah,
And,
that's the standard question, but I don't think they will be rejected not to get vaccine, because that will be basically harmful even for the country. Like if you have people who are not vaccinated. So I'm not very sure that this is happening, but I can check with my colleagues from Department of Health who are involved with the vaccine rolling.
Please, if you can give us a link, if you can give us a link to me or Dr. Suman, Counselor Suman Saha, then we can get, because there are a lot of people from non-NESP, non-English speaking background, which we would like to do in Harris Park.
No, I definitely can get that information, but I think when I was trying to book, there was option like Medicare and non-Medicare, and it's not like that. If you don't have Medicare, you can't book it. You can still book it. I'm not sure how things are happening with the GPs, because that's a different setup. So GPs might be a bit different, but the normal vaccination through the government hubs and all, I think it should be still okay, but I'll get more information. I'll get back to you.
Thank you, Mr. Suman Saha, for organizing this. I have a question for Dr. Saab. I'm 45-year-old and I had a Pfizer vaccine already, and the second dose is due. Can I take the Astra? It's gonna be anything like, or just is advice is to take the Pfizer as well on the second one? Like, and if I take, it's gonna have extra boost or extra immunity power or anything like that?
So you want to take it because you think that it will boost further rather than having a second dose of Pfizer. Am I correct?
I'm just asking if there is any benefit mixing and matching.
No. So we don't have any data. There are a few studies where we're doing mixing and matching, but they're all purely for logistic reasons, not that the mixing and matching will enhance the results. So just to give you a background, so all these things started in the beginning when there was some shortage of vaccine supply and people were kind of getting delayed for the second dose. And this mixing and matching was tried at that time. And some of the preliminary data are saying that it is kind of okay, but it's other way around. So people who had AstraZeneca were taking either the similar platform vaccine like Sputnik V and other ones, or they were taking Pfizer. So not other way around, like having Pfizer and then taking AstraZeneca. So because Pfizer itself has got around 95%, and I don't think even if you take AstraZeneca or any other vaccine second dose, it won't go to 100%. It will 95, 94 is pretty good number. There are hardly few vaccine which has that level of efficacy. So I would definitely not recommend to mix and match. Definitely it's not recommended in Australia. Some of the countries who struggle to procure the doses for second dose, they definitely tried all this and they went ahead with all these schedules where they mixed and matched. The thing is that those two vaccines, completely different. Their studies are different. Their dose gapping, because when we do a vaccine study, we always have a duration where we give the second dose. For AstraZeneca, they had two groups. One was given at 4 weeks, one was given at 12 weeks. And the 12-week one, they had a better response. That's why initially the recommendation was to get the vaccine as 12 weeks. But now because of the current situation, we have gone a bit backwards, like 6 to 8 weeks. But I would definitely not recommend to mix it with AstraZeneca. Just continue with Pfizer vaccine.
There was a question about Medicare. Both the Prime Minister and Gladys Berejiklian, they have announced at least 10 times each that irrespective of your Medicare status, the vaccine is free. And there are multiple places where you can go and get it done. You don't have to go to GP because GP may charge fees for his or her consultation. You can go to the Westmead Hospital or Olympic Park hub. So the vaccine really is free for anybody, students, visitors, people without, even the people who are in Villabu Detention Center, everybody is getting free. So that's very clear. So it doesn't matter about that one. So I don't have any question. But about the vaccine, I think confusion was created by ATAGI, the Immunization Advisory Committee. And now Prime Minister is now walking back a little bit. And what they said was the 60 or above, they said it's not recommended, but you can go and talk with GP, and GP will do the cost and benefit risk assessment and then will tell you. I think at the moment, as things are going in New South Wales, if you are any age, you should go and see your GP and talk about your risk. If you have diabetes, if you have chronic lung disease, if you have chronic kidney disease, if you have immune compromised status, you have high risk of having COVID. So you probably would be benefited by having the vaccine. So again, GP is the central person to go and ask about your risk and benefit. Please do not rely on WhatsApp University. WhatsApp University is, you know, that how much harm they do. Do not rely on them. And do not rely on non-medical person giving medical advice, which is very common in our community, particularly in our community. Do not rely on these people who have no clue what they're talking about. So two things I request. One, WhatsApp University, ignore it. Number two, non-medical loudmouths in our own community who wants to be a hero, don't listen to them. They've got no clue. Doctor, GP, that's all, nobody else. So this is what you should do. Let me tell you, my whole family has got vaccine. Luckily, Medico, we got Pfizer. Family members also got Pfizer. But if they had not got it, I would have told them to go and get AstraZeneca. Of course, you know, they got the vaccine. So please, please, please get the vaccine. And I think Deepak mentioned very quickly, there was an article which I found very informative, and I put that in my Facebook. The risk of the clot is 3 in 1,000. 3 in 1,000 in Australia. And so the risk of dying is about 0.00009 from the vaccine clot. The risk of dying from the virus is about 0.0004. So you can see dying is bigger risk from COVID than dying. I think Deepak mentioned that, dying from the vaccine. And remember, I think he also said that, and that was an article too, that you have higher risk of dying from driving a car. And you also have higher risk of dying from having few drinks, not one or two, which is what we do, many drinks. You have higher risk of dying from Indian style of drinking. Okay, so you know, we go Patiala style and we have 3 drinks, which means 8 drinks or maybe 9 even, depending on how big is Patiala drink. So you have higher risk of dying from some extra amount of alcohol, driving a car, than dying from COVID. So please, I would strongly urge people, particularly those who are 50 plus, those who have diabetes, those who have chronic lung disease, those who have chronic kidney disease, those who are immunocompromised, obesity, heart disease, go and see your GP. Go and see your GP. And I will close this, what I was saying. And again, repeating, do not believe from what you read in WhatsApp. And do not believe what you hear from the loudmouth hero in their mind, Indian community members without medical degree, and they talk about medical things. Do not listen to them. So that's all I'll say. Thank you. I have friends in this area, and somebody in Harris Park who runs the restaurant, and he asked me, had been asking me, come over, nobody would know, come over and have, you know, a drink or something, or maybe food or something. I know it's illegal, and I haven't gone there because he said, no, you can say that you have come to pick up the takeaway. I said, yes, a pick up takeaway means 5 minutes in your place, not having drink with you or food with you. Is it legal that I can extend 5 minutes into 25 minutes or 30 minutes? And that's not my family member, that's a business owner. I'm sure it's illegal. Officer, what is your view?
Look, Doctor, I agree with you. And as I mentioned earlier, the idea behind having these restrictions and the reasons for which you're allowed to go out, it's not to beat a fine that you're likely to get, but that is to beat the virus that follows no law and does not respect any boundaries. So you might end up avoiding getting a fine from police, but you might still end up catching a virus, which we all know is very, very, very serious than what we saw 12 to 18 months ago.
So the religious organizations are classified as non-essential, but say I live in Stratfield and our temple is in Mayes Hills. Being a public officer, we need to do certain things not only me, even the other people who are directors of the organization have to attend to certain important jobs. What is the status? Can they travel to the place of worship, which is their place of work, or is there a restriction?
Okay, in this case, your place of work happens to be a place of worship. However, the premises, the purpose of premises is basically depends on what activity is carried out. So if you're attending temple in Maze Hill for worship, it's a place of worship. If you're going there to fix infrastructure or take care of financial side of it, it's a workplace. In saying that, we really need to ask ourselves a question that can these things be done from home?
Yes.
If not, can there be arrangements put in place? Because about 18 months ago, everyone used to go to work, and most of the people, the idea of working from home didn't exist. We were forced into a situation where we had to come up with a plan where we can work from home. It might be the same case for you as well. You might need to figure out how to work from home. Because as I said, whether it's a reasonable excuse or not, it's a question for lawmakers and law enforcers, but it's not a question for the virus itself.
Yes, the issue is that the place of worship, we don't attend to the place of worship. We come to the office, which all the documentation, and we have regulatory issues that we need to attend to regularly. So that is the reason. We don't actually visit the temple, though it's in the same area, but the public is locked. Nobody is allowed to come in. Only when we have to do work, we have an access through a side door. We can go in and do the job and come back, is the question. So what happens when you're caught by police on the way? What do we tell them?
Okay. Look, I can't really tell you when you get pulled over by police what to tell them. But in your case, it pretty much is a workplace. Workplace like any other office. You basically need to give satisfactory answer to the police officer to let him or her know that whatever business that you were attending could not have been done from home, and it was essential.
Yep. That's a good. Then another quick question. Now, we look after our grandkids. Now, they live 5 minutes away. Now, 2 of them are older and one is a smaller one. So my son has to bring the smaller one to our house for us to look after. So he can't leave the other 2 kids at home. So can all 3 travel in the car at the same time, all 3 kids with the father?
Yeah, family members who live together, they are allowed to carpool. And since you're looking after young children who cannot care for themselves, you're providing care. So they are allowed to be at your place, you're allowed to be at their place. However, if you are to go and provide care at your son's place, it has to be only one person.
Correct. Thank you very much.
I have 2 questions. I'll ask them both at the same time. So one question is, there's a lot of confusion about what is essential and what is not essential. So is there a place where we can actually get updated information on what is essential and what is not essential? My second question is, I understand that mask is mandatory, and even with mask, this particular variant does not see mask or no mask. However, are there any exemptions? Because I am a mental health professional, are there any exemptions of mask wearing within a vicinity under any circumstance? And if there is, how do we go about applying for that?
Your question seems to be for us and Dr. Rai as well. Look, in relation to exemption to wear mask, that strictly has to be on medical grounds. And again, on medical grounds, you have to consider that is it not wearing a mask would put you in a more or significant in harm's way than wearing a mask and maybe have slight discomfort with your physical health. We really need to compare on case-to-case basis in this case.
I'll add something to that. So basically, it is allowed for if you have significant disability, which kind of creates problem for you for wearing mask, or if you have a skin condition which flares up after putting up a mask, or the person has got significant mental health issue and wouldn't allow to keep the mask. So it is allowed for them not to put on the mask. But I think it's from today only, or from tomorrow, that you will need a letter from your healthcare provider, either GP or whoever is. And it should be always with that person that this person is allowed not to wear the mask. So you need that paper from GP or your healthcare provider. But yes, you're allowed for mental health patients not to wear a mask, or any significant health conditions like having skin conditions on the face, which worsens with the mask. I think till yesterday, it was like you just need to tell, okay, I've got this condition, but now you need a certificate. So from GP or your healthcare provider to show it whenever asked that this is a certificate and I'm kind of exempted from wearing mask. But having said that, not wearing mask shouldn't be taken as a luxury. So you still need to take all the precautions, try and keep the social distancing and do hand cleaning and whatever way you can protect yourself and the person who has got the condition. I think that still is recommended. It's just about the mask that it is not essential if they have that condition, and because of that, they can't put on the mask.
School kids, for the medical professionals on the call. I've got school kids. Is there any new data available of how risk there is now with the new variant, and eventually when they go back to school, what precautions would you envisage us to take at that time?
Oh, thanks. That's a good question. I can't remember any data on top of my head, but definitely this Delta variant is much more infectious for the kids. And there are reports where it's very clear that it affects the children much more than the previous Wuhan. So definitely affects the children. And I think the other question was what you can do for the school. Again, that's a very kind of questions for the logistics. I would say vaccinate all the teachers to protect them. Most of the schools, they are still like under 18. So there's no vaccine yet approved for under 16. 16 to 18, you can still use Pfizer, or 18 onwards, you can use AstraZeneca. The Pfizer vaccine for adolescent population that's 12-year-old plus is under evaluation and should be approved very soon. But the question will be again about the availability. So for the time being, it's only recommended for Aboriginal and Torres Islander children. So they can have vaccine regardless of their age because they're at high risk. But apart from that, I think it's just the normal precautions that we take. I don't know how practical would be I can tell, okay, everyone should wear a mask, everyone do frequent hand washing and all, but how practical it will be, I don't know. I can't imagine like 40 kids in his class all wearing masks and speaking and the teachers teaching. That's not very practical. But the way forward will be to vaccinate the adults first, obviously, the teachers, and then adolescent population whenever it's available, and take all these normal precautions. Don't crowd at front of the schools. Try and quickly drop the kids and go back rather than just mingling around with the parents. So it's more like a common sense when they start, and have all the precautions at the school, have hand sanitizers ready, spare masks if someone is not feeling well or coughing or sneezing, they can use it. Not like a blanket, everyone has to. So just like, I think there has to be some sort of a strategy, which obviously will be kind of done by the Department of Education on our recommendation, but that has to be something which will be done before we restart the school. Vaccination, as I said, is for older kids. And again, I doubt that will start very quickly. So they will be probably lost in the time to get the vaccine probably sometime next year. For the timing, it will be just precautions. So yeah, even if it gets approved, which will happen soon, it's approved from our side. It's just a few government steps which are still pending. But I would say that normal precautions which we have been taking, I think that's what was going to be recommended. And as I mentioned, the teachers should get vaccinated, and plus normal precautions. If the child is sick or if your family member has got is sick or something, get tested. Don't send your kids to the school. All these normal precautions should work.
Okay, thank you.
Thank
And
you.
Suman and I think the good thing, very good thing is that those kids less than 18, I don't believe we had even one person less than 18 who has gone to hospital in ICU and ventilator. That's very good. They do get infection, but it's milder. So that's why in Australia, we didn't have anybody that less than that age dying or needing the problem. I know there's one guy 18, right?
One teenager was in ICU. I don't think I'm talking about Australia. He didn't die. The deaths were all like seniors, 70 and 80, and one was 55. But I think the kids get infection, and that's where the problem is. They get infection and they'll spread it to people who are more susceptible. That's why I'm saying the teachers should get vaccinated first, because they're the ones who will get the serious disease. So teachers should get vaccinated first, and kids whenever it's available.
And that also means it's bring infection home. So if we are immunized, vaccinated, then we are not going to get affected by the virus. So it's very important for adults to get vaccinated.
Exactly. That's the point. Even if we get infection, we won't get sick, because the antibodies and all those things work when your infection has reached your blood. So before that, you can get mild symptoms, but you won't get sick. So if you read the data for prevention of serious disease and death, is great, like 90%, 95% even for AstraZeneca. So whatever we are talking about, 70% or 95% is just the test positive or mild symptoms. So, but we are not worried about having mild sniffles. We are worried about the serious consequences. And when it comes to prevention of death and serious diseases, there's not much difference. And there are some real world data. I think it was published yesterday only from New England Journal. And they compared like this scenario where people were vaccinated and not vaccinated. And it's a real world data, so obviously it's not a very kind of scientifically designed study. And they found that there's a huge difference between people who developed severe disease who were not vaccinated, like in thousands, and people who are vaccinated were like in double digit only. So yeah, you may get infection, but you won't get serious. That's a very good point, Dr. Yadavi.
And I think Kerry Chant mentioned that yesterday or day before. She said the people who are in the hospitals right now in Australia, I think 78 or 81, and almost all are either not vaccinated or had only one dose. So that also means that if you are vaccinated, you have very little chance of needing the ICU admission, needing the ventilator treatment, or dying. And I think that's the more, and I think all are similar, 92 or 94.
Yeah, they're all above 90. Yeah.
The question is, just a minute, is that we like to find out for the call communities, and I'm thinking of the Indian community. Now, there are a lot of seniors also, like who wouldn't be able to access the information we are having today, or on the web, or on the information, because they don't have technology, they don't have the skills, or they don't have the education. So there are a lot of people are there. So my concern is there any plan? How do we access, especially in the areas where is the COVID spread is too much? There are a lot of people, Indian community, as well as many other Chinese, Lebanese, and all called communities. Do we have any way of helping those people for all this important information? And I must say, thank you very much. Very informative session. But my concern is for those people who will not be able to benefit what we discussed today.
Thanks for the question, but I'm probably not the best person to answer, but I've been attending quite a few meetings where we have leaders from the multicultural society, so religious leaders and the community representatives, and we discuss all these questions like we are doing here. And we presume that it's their duty and they go in the committee and spread those words, because for government, it'll be really, I would say, almost impossible to appoint people who will go in the committee or smaller committee and explain everything. Definitely, there are resources in multiple languages if you go on NSW Health's website. So pretty much every language is there. And I understand not everyone has access to technology or very technology savvy. So obviously that's the problem. But yes, definitely government is trying. I'm not sure what's happening at the council level or committee level, but even I've been involved in some of the meetings, but at ministry level, I'm not sure, or community level, I'm not sure what steps they're taking, but definitely that is in mind. And the federal government and the state governments, they are taking quite a lot of steps. And I know at Fairfield and all, they have involved the community leaders to spread the awareness. So this is happening in that area. I'm not sure about the Indian community, but I mean, this is one of the initiatives. We are doing it for Indian communities. So similar initiatives are happening everywhere. But if government is actively doing, they're doing at the leaders level. So maybe Dr. Yaduji is involved in some of the meetings, I'm not sure, or he was, but they're doing at the leaders level, but they're not like doing just like political gathering where you have 200 people from Indian committee and someone is speaking. They don't do these sort of events, but they're definitely involving the committee leaders.
So can I please ask you, if you have groups, you can talk to police as well. So multicultural community liaison officers are trained in different languages. For example, myself, I can speak Hindi and Punjabi. So we could run those sessions for you. Which would be law enforcement tailored sessions, similar to this, but would be answering all your questions that the community have. So we also connect with the community groups and answer those questions in that way through Zoom.
Thank you. We are trying our best, but I still feel there are a lot of people, they can't even use Zoom as well. And we have it Facebook Live as well. But anyway, thank you so much. It was a great session, and together we'll try to do what we can. Thank you.
Thank you, Vijinderji.
And Vijinderji, sorry, just quickly, like if you feel like any of those Zoom meetings, you need some information which I can provide, I can speak Hindi. Punjabi, I'm not.
We might invite you. Well, we will take you up on that. We have regular meetings twice a week. We're doing, so we'll be. Nice
I don't think I can do twice a week, but I mean, definitely.
Once in a while, not all the meetings.
I'm more than happy to kind of find and provide us whatever information I can.
Thank you. Really appreciate it.
Thank you, Deepak ji. Now, may I request Dr. Tanima Banerjee? I think this one is for Rachna ji. Please ask your question.
Okay, thank you, Sumanda, for a wonderful initiative. So most of my questions well answered by Deepak ji. So one question to Deepak ji first I would like to ask that regarding this vaccine, there are many myths like what as Yadu Singh ji has told, that WhatsApp, everybody's making, scared that after taking vaccine, you cannot move your hand and all. But I would like to know that there are mild symptoms might be after getting that vaccine, and what you suggest after vaccine, because I might getting the dates very soon. So I'm just asking you, what are the precautions we should take after the vaccine if any swelling or anything happens? And also, how long does it take to build immunity after getting this COVID-19 vaccine? So these two questions to you.
Okay, so starting from your side effect thing. So basically you have two types of reaction. First thing is called reactogenicity, which you get within 7 days, which are like pretty common. You'll feel a bit weak, maybe mild fever or body ache and malaise and injection site pain. So you can feel pain where the injection is. And then there's some what we call adverse events. So things which are unsolicited or you're not expecting that. So those things can happen, but those are very, very less common. So I'm not even going there. I'm thinking that common things are common. So with AstraZeneca, I think the majority of side effects happen after first dose. With Pfizer, more common after the second dose, but it's nothing major. You will have injection site pain, which is more common with the mRNA or the Pfizer vaccines. So which one you're getting? Can you clarify? I can be specific for that.
Pfizer, I think.
Pfizer, okay. So
Yeah,
Pfizer, usually you get more side effect after the second dose. And majority, or I should say around 70%, is the injection site reaction. So wherever you have injection, it can pain, because the vaccine, how it works, it goes there and it enters into your lymphatics and causes the inflammatory reaction there. And so obviously there will be some local reactogenicity and you'll have some local pain. Some people, again, the pain tolerance is different for different people. Some people can just work normal with that same amount of pain, and some will say, oh, happening try. So it's the same thing,
okay.
but it's not neurological. So it's nothing like neurological damage and you can't move your head. It's just the pain. And you'll have mild fever, you can get mild headache, just very constitutional symptoms you can get. And it will happen majority of time up to like 48 hours to 72 hours. It can last even up to 5 to 7 days. But there's nothing major that you need to take precaution. You can have some Panadol just after having injection. But majority of people who I have seen, they're all fine, including in my house as well. So I don't think there's anything to worry or get scared about. And yeah, just
how long does it take to build that immunity after getting that COVID-19 vaccine? Is there individual to individual? It must be varying.
Not really. So immunity again is a very vague term. So you don't know how you define immunity, but what we say is the protection against COVID-19. That's we say like immunity. So immunity, you get some degree of immunity even after first dose, but optimum or the best immunity, or we can say the maximum immunity you get is after 14 days of second dose. So once you have received second dose, after 14 days, you develop optimum immunity, which is going to last. But there is some degree of immunity even after the first dose. Unfortunately, it's not much with the Delta variant, but the previous variant has to have like around 70, 80%. With Delta variants, I think it's around 50%. But again, those are the numbers. I mean, just to get an idea. But yes, 14 days after the second dose, you get your best level of immunity. Then afterwards, obviously, yeah.
Okay. And my another question to Rachna ji and team, that that non-school going infants and parents, those who are professionally working and very busy, how to safeguards from that emotional breakdown, and which is very difficult nowadays.
Emotional breakdown. I think we all are having emotional breakdown. No, it's a struggle. I understand, Tanima, sorry. We have our own coping mechanism. Our bodies built that. If you find it's very stressful, take some break, take some time off. That's what we are doing in the police. We are also trying to space everything out in a way where kids' house lockdowns are managed in a way where it's not stressful for us. And I think looking at, I mean, that's more of an advice which I think Amit ji could give here, who was here, who is into meditation. I think that's one of the other coping mechanisms that you could follow. But it's personal basis. Police is there to support, health is there to support. There's a lot of literature, there's a lot of information out there. It's yourself personally as a family. What do you choose to choose as an option as a coping mechanism?
Just to add that from pediatric perspective, you have got some help. Obviously, they wouldn't provide in-house help now, but Tresilian or Caritani, they're the two organizations who provide help with coping strategies, especially with like infants or the toddlers. So you can always ring them and discuss with them. So if you see the blue book at the back, there will be Caritani and Tresilian. So just ring those numbers. You don't need a referral. You can do self-referral. They used to have a residential program as well. I'm not sure how it's going with the COVID, but they're a good resource to have, especially regarding coping skills and how to kind of settle the kids and all those kind of tricks that they will tell you. So they're a good resource if you want to ring them. I'm not saying you need one, but if you.
Thank you.
Thank you. Very informative. Thank you.
Thank you, Deepak ji. We have only 8 minutes to go. With that in mind, may I request, I can see Indranil, Haldar, and Jen, if you can please ask your question. You are muted.
Okay.
Yep.
Hi, Shuman. Thank you very
Hi.
much for this
Hi, Jack.
informative session. I'm enjoying it a lot. My question is for the police. Now, a lot of people are living in confined spaces, unit blocks and things like that. How are you combating the situation of perhaps, 4 or 5 friends perhaps are all going for a walk at the same time, then perhaps on a corner or at a park, they're actually congregating together and chitter-chatting. So what kind of mechanisms have you got in place for these kind of things happening? Because it's quite, a common thing to be seen around the community at the moment. Yeah.
Jane, thanks for that question.
Yeah.
At the moment, there's only 2 people from the same household allowed to go out with the new restrictions. If you find that congregation is happening,
yes,
you're more than welcome to call the police. You can more than welcome to drop in an email or a phone call and say this is happening.
Right.
We'll send the police through. There are fines, on the spot fines available. They'll be given, handed tickets would be given to the people who are congregating without any reasons.
Right.
So it's a possibility. Police have increased their patrols. I would tell you, during the day and in the night, there is a special task force, which is during the day, we call it hour of power. Every hour, starting from 9 a.m. till the 9 p.m., every time there are 2 police officers attending community and also the places of residents, streets, just patrolling.
Okay. Right. I just have seen in a couple of circumstances, like maybe 5 different people from 5 different households congregating at a park, chitter-chatting together. I mean, obviously for mental health reasons, perhaps they need to do this, but they're not actually following the rules which are
absolutely
in place at the moment. Yes.
You have all the rights to call the police and let us and inform us.
Okay. Thank you very much.
Not a problem, Jay.
Sumanji, one point has not been mentioned by anybody. If you have received AstraZeneca vaccine and you are waiting for 3 months, which was the rule before, that rule has been now changed, and you should go for second dose of AstraZeneca at 6 to 8 weeks. Don't wait for 12 weeks. You should go for the second dose as long as it is 6 to 8 weeks after the first dose. But very, very important, because as Deepak mentioned, you get immunity within 2 weeks. Don't delay it to 3 months. Get it done 6 to 8 weeks after first dose of AstraZeneca.
It's a very personal question. I am about to get the Pfizer vaccine, but I'm also in a research study on meningococcal vaccine. Now, this vaccine is going to be administered to me in between the second dose and the first dose. Do you think it is quite possible for me to take the meningococcal vaccine in between the first and the second dose, or I just get out of the research at the moment and just let the first and second dose of the Pfizer vaccine take its effect and move on from there?
That's a very good question, basically. And this is where we've been saying that the data is lacking. So they haven't done any co-administration of vaccine. And one of the important ones, we are looking for flu vaccine, because they kind of clash with the COVID-19 vaccines. So unfortunately, we don't have data. So it's hard to comment. And since we don't have, and we can't establish the safety, so I would say if you can pull out of the research, and because we don't have any data of co-administration, not with different vaccines, not even with the same vaccine, like COVID-19, different platforms. So we don't have any data for co-administration of the same vaccine or different vaccines. So it's just that we don't have any information, so we can't predict. It's just like taking any chance. So I would say, I would recommend that,
So the pull out of the research and if I need to go into the research later on, it has to be after the second dose had been administered, and it is after 7 days to 21 days after the second dose. Am I right?
Yeah, that's correct. So even if you consider, okay, you want to join, it shouldn't be between the 2 doses or anything, just because we don't have data. So we can't kind of assure you that, okay, it's fine and you can go ahead. So give time to have this vaccine fully effective. That takes around 2 weeks. And then after that, you definitely should discuss with your research organizers that I have had this vaccine, whether it's safe enough or not, because I'm talking to you about just the COVID vaccine, that the data information that we have. But your research people might have some sort of, theoretically, it shouldn't cause any problem. It's just like having 2 infections. So you have flu vaccine and flu infection, and you have some other infection. And we mix vaccines. So we have got influenza hexa, which has got like 6 different type of vaccine in one injection. So theoretically, there is no risk. It's just because we don't have any data, so we can't recommend you to do that.
Got you. And one more quick question I have on that is the Pfizer vaccine and the AstraZeneca vaccine, as I understand a little bit of research that I have done, that the Pfizer vaccine does give 90% coverage, whereas the AstraZeneca a little bit less, but that is from the first variant. Now, when we are talking about the Delta, it is that the AstraZeneca gives a coverage of only 10%, whereas the Pfizer gives a coverage of 45%. Is that true? I just want to clarify that.
Again, I'll get back to Yadav Singhji. That's what he said, that don't do Google, don't do other resources. So basically all these data, I don't know what's your source of data. So
this is from my doctor.
I don't know where he got this data. So we don't have any clinical efficacy data whatsoever for Delta variant at this stage. We have some real world data, which I mentioned before, where it's around 60% for AstraZeneca and around 80% for Pfizer vaccine. But again, they're not well conducted, these studies. They're just real world data where they just collected the data and compared. And what they have done is we call neutralization assay. So they take the serum from the people who have been vaccinated and they incubate with the pseudovirus or the real virus and see how much virus is getting neutralized. So it definitely does neutralize the Delta variants as well. And now I'm going back again to Yadavji's question of protecting the serious disease and deaths. Serious diseases were significantly prevented even against the Delta variant. So I can't share the article now, but if you Google, you will find the real world data from England, and it's published in NEJM, so New England Journal of Medicine. It was published yesterday only, and you can see the difference. Like the cases, and I'm talking about Delta variant. So the people who were vaccinated, the number of cases are like in 100 or even less than that, double-digit number, whereas unvaccinated is thousands. So there is definitely significant difference. And one thing I would like to say, this fascination with the numbers like 10%, 45%, 80%, it doesn't mean anything. It doesn't translate into clinical efficacy in the community. This is just a part of a small publication or some small group of research. We are talking about millions here. So I would say, don't even kind of get distracted by those things. Just go for the vaccine, and both vaccines are good because we are not talking about having sniffles or something. We're talking about protection for serious disease. So both vaccines have pretty much similar efficacy. If one article mentions 70, doesn't mean that it's 70. It can be 80, it can be 50. These are just a small sample size they normally comment. And it is effective. Efficacy may be a bit less than the prototype variant, but all these efficacies are for infection, not for serious disease and deaths, which is significantly prevented by both vaccines.
Thank you so much. Thank you then for the team for organizing this. It's a great effort for some understanding and clarification, and thank you for your time.
Thank you very much. Now Rachna Soniji from Parramatta Police Area Command has to leave. And we have 3 questions that was for police. One from Bipasha Poddarji and the other one is from Sulagnaji. What we'll do, we will send you the response from police to you by email. Thank you very much, everyone, for joining us tonight. And once again, thanks to Dr. Deepak Roy, thanks to Senior Constable Mani Vegala, Constable Karan Chauhan, and Rosna Soni, Multicultural Community Liaison Officer from Parramatta Police Area Command. And most importantly, we like to thank and acknowledge all that our health heroes, our law and enforcement agencies, and all the essential workers are doing to keep Australia running. Good night. Thank you, everyone. Thank you for joining us.